All right, hello everyone. Happy Friday. It's Rundy Murphy, epidemiologist and director of disease surveillance at the Mobile County Health Department, coming to you live from our downtown location at Keeler, 251 North Bayou, where we have COVID testing 5 days a week, Monday through Friday, for anyone who meets the criteria and needs it. So we'll start today just by reading our numbers this morning. The report that our public information officer put together as of 9 a.m. this morning. Worldwide, almost 3.3 million cases of COVID-19 with 234,000 deaths. United States, just over 1 million cases of COVID disease, so 1,070,000 with 62,996 deaths. In Alabama this morning, ADPH was reporting 7,085 cases of COVID-19 disease with 279 deaths. In Mobile County this morning, the public dashboard was reporting 1,078 confirmed cases of COVID-19 in Mobile County and 57 COVID-19 related deaths. Dr. Eishold reminding us this morning that for 16 days in April 2020, COVID-19 killed more than 2,000 persons per day in the United States. And since January 30th, it's killed an average of 693 Americans per day, and 2,390 people, so nearly 3,000 people died just this last Wednesday. So just want to remind you that this is a very serious pandemic situation that we found ourselves in. There is still widespread community transmission going on in Mobile County. Lots of folks have noticed that we have the most cases than any other county in Alabama. And we just want you to remember that this is still an extremely vicious virus for those who are at greatest risk, that transmission is ongoing and it's highly infective. So every one person that gets infected could expose up to 3 people. And so we just want you to remember, if you go out in retail or if you go to the beaches, if you exercise, if you take advantage of the restrictions that have been lifted this weekend, please do so carefully and wear a cloth face covering when you're out and about in retail, and maintain that physical distance of 6 feet or more when you're in retail stores, in businesses, or if you're outside or if you plan to go to the beaches. A little bit more detail about the cases in Mobile County. Again, we have about 16% of our cases have been hospitalized at some point in their disease progression. We don't know how many of those are physically in the hospital today. That information is provided daily to our partners at the ADPH Center for Emergency Preparedness through the AIMS system. That information is made available to on a need-to-know basis to decision makers at the health department and some other government leaders. But that information on the daily number of people who are currently in the hospital is not made available to the public by public health. If the hospitals wanted to release that, they could, but we don't release their data. Again, we have pretty stable distribution by age group, by sex, and by race. Our zip code map is heavily influenced right now by the outbreaks that are happening in the long-term care facilities. So you will notice on our map that the zip codes that have some of the densest color, where indicating that they have the highest number of cases, some of them have long-term care facilities in their zip code that are reporting a large number of cases and kind of driving up the numbers in those zip codes. So I'll read a little bit of information again about the 138 hospitalized. So about 16% of our cases, their age is spread between 25 and, our oldest I think is around 93. And among hospitalized patients who we know their sex, about half of them are male and the other half female. 2/3 of them are African Americans and the balance are white, Asian, or other. For our deaths, We know that some of our deaths reported have occurred among long-term care facility residents. I think the last time I looked, among the 57 patients who died from COVID-19 that we were reporting so far, at least 21 of those were associated with a long-term care facility. They're between the ages, again, of 52 and 83, 34 male, 23 female, 31 African American, 23 white, and 3 other. Someone commented that I had taken this statement out, but we returned this comment that each of these people who died had risk factors for severe complications of COVID-19 disease and were under the care of a hospital or a long-term care facility at the time of their death. And again, just to remind you of the seriousness of this outbreak, that around 7% of our cases have died and 16% have been hospitalized with severe complications of disease. So on to some information share. Today, posted on our mchd.org website, along with our other COVID resources, you'll find this map that was produced by the city GIS department. We're very thankful to Pat for that. It provides the testing locations in and around Mobile County. And again, I just want to emphasize there is open testing at most of these locations. You can get the information on our website about their telephone numbers. The new Saraland location at 1095 Industrial Parkway, need to go to myquestcovidtest.com to answer some questions to see if you qualify for open testing at that new location at the Walmart Saraland. All right. I alluded to the slight relaxation of public health orders under the governor and state health officer Scott Harris's Safer at Home Act that went into effect yesterday at 5 p.m. I know this for a fact because my brother went straight to the beach in Gulf Shores and caught some pompano last night. But I just want to remind you that if you violate any sections of that order under emergency rule, a violation is a misdemeanor. So please take those that health order that has been made into an emergency rule very seriously. If you violate any of the sections of that order or the directions of that order, you could be charged with a misdemeanor for those offenses. All right, some questions now. Let's see, there are just a couple from the media today, so thank you. One was, do we need to do wider testing of the population to discern how prevalent the virus is in the general population? It would be helpful to know what the underlying prevalence is of the disease, who has gotten infected that we don't know about, because again, we're testing those that meet a certain criteria, but right now we don't have the appropriate test to quickly determine what that prevalence is. There has been talk about these antibody tests that are being used for first responders and some different areas, different populations, and that is not an appropriate test for determining the prevalence in our community. So it's just not time yet. We're not there yet to do those types of sero surveys where we would measure the amount of antibodies in a random sample of households or in a random sample of our population to determine what the prevalence was. And again, prevalence just means at some point in the past you have been exposed or infected with the virus, but you don't currently have it at the point that you're tested. And so there is still a lot of talk about the appropriate use of antibody tests. And I wanted to just read for you a little bit about what an antibody test means and does not mean. And this was provided by the CDC, that serologic test should not be used as the only way to diagnose someone as currently being sick with COVID-19, even though they are sort of slowly coming on board. So an antibody test is also called a serologic test or a serology test, and it checks your blood by looking at antibodies that show if you had previous infection with the virus. And depending on when you were infected and the timing of the test, The test may not find antibodies in someone with a current COVID-19 infection. And again, the antibodies are these molecules or these cells that your immune system makes to help fight off germs. So it's a protein in your blood that circulates to help to fight off the infection. So here are some things to think about if you are considering the use of an antibody test. And again, there are only 3 that have been FDA approved under emergency use authorization, and they're very difficult to get these days. But if you test positive, it could show that you have antibodies to SARS-CoV-2, the virus that causes COVID-19, or it could be related to exposure with a related coronavirus. So they're not specific to just the virus that causes COVID-19. It's also unclear if the antibodies will provide protection against getting infected again. It's just too soon to know that antibodies will protect you, and the test can't decide or can't discern whether you have antibodies to the novel coronavirus or to another common coronavirus. If you have no symptoms and you test positive, you likely don't have active infection and no additional follow-up is needed. If you have symptoms and meet other guidelines for testing, what we really want you to do is to have a PCR test. That is the confirmatory definitive test for infection. And again, this is using a nasal swab or a nasopharyngeal swab. And a serologic test alone could not determine that you might have infection. You would have to have that followed up with a PCR test because that is the definitive test. Let's see, if you test negative, you probably did not have a previous infection. However, you could have a current infection. It's possible that you could still get sick, even if you've been exposed and you have the virus inside you, but your body has not had time to produce those antibodies, so that's why you test negative. Some people might take longer to develop antibodies than others, and some may not develop antibodies at all, depending on the state of their immune system. So again, there are just too many uncertainties with the antibody test for us to be able to rely on it right now. So we're continuing to rely on the PCR test as the definitive test for evidence of COVID-19 disease. Later on, after there have been more cases and more science and more data and better antibody tests, then yes, we hope that we will be able to determine what the underlying prevalence is in our community. Okay, I've talked about that for too long now. Let's see, I already answered that one. The last media question that we have was about how deaths are recorded. Is COVID-19 listed as the cause of death or a contributing factor, or does it depend? It depends. If they die in a hospital, then the physician is the certifier on the death certificate, and they determine if it was the cause of death or a contributing factor. If they're not in a hospital, or if they don't pass away under the care of a hospital or a long-term care facility, then that job of certifying the death certificate goes to the coroner or the medical examiner. And again, they would, through autopsy and testing, determine if it was died from COVID or with COVID as a contributing factor. Then the other question here was, there have been reports of people developing side effects like blood clots. Have we seen those kinds of things locally, and is that noted on a death report? I'm not aware of any information that, Mobile County patients are developing blood clots. I've not seen that in a news report or in the literature, but I will admit that I am not able to keep up on things as much as I would like to. So stay tuned on other types of side effects. All right, here are some Facebook questions, and again, these probably came from yesterday. We usually pull them off while I'm talking, and then I handle them the next day. But so here was a question that says, can you tell us among the confirmed cases how many of them are in a nursing home, retirement home, metro jail, that sort of thing? I can't tell you specifically how many are in each facility, but when I looked at the information this morning, it seemed like about 16% of our cases were related to residents in a long-term care facility. So I realize that people, would like to know, is it the long-term care facilities that are, driving our numbers up and our deaths up? I think it's probably not, it's partially responsible, of course, but it affects our death numbers more than it does just our overall numbers. Why are we reopening a county while numbers are still increasing? That was a decision made by the state health officer and the governor in consultation with, their informed leaders and also with the Centers for Disease Control. They felt like a controlled relaxation of the public health orders was appropriate at this time. Again, we always try to balance health and safety with things like economy and culture and social determinants, that sort of thing. So it's tough to strike the perfect balance, but I think the part of the reason that the current safer at home order only goes through May 15th is so that we can closely monitor, and if we need to restrict again, we may see that happening. If things go lovely and everybody follows the terms of the order and we don't see case counts jump up, then perhaps they would consider a further relaxation. But I just want to remind you that this is just, we've never seen thousands of people dying every day from this illness. It's unprecedented. It's a pandemic, and it's very, very serious. Okay, let's see. So someone who wrote in to say that they have a colleague or a friend, maybe a relative that works in a healthcare institution and was told to code everything as COVID-19. That we do, since our hospitals are not right now, have not been doing non-essential services, have not been doing elective surgeries, there probably is, COVID probably is the biggest part of their business right now. And also it is important to code a patient as COVID related if they are, because there's funding tied to that. And that's really important. In a federally declared disaster, there are different ways that monies are appropriated for reimbursement, and it's important to document your activities and patients and expenses that are related to a COVID illness. And the question here is, have you noticed since COVID no one else has died from anything else? So yeah, there has been a reduction in many things because people are staying at home, so we're not out there having our same movement about the community. So we have seen not just drops in some types of illnesses or diseases or injuries, but drops in crime rate, that sort of thing. So yes, it does seem like everything going on right now, we're always talking about COVID, but we have people that are still continuing to work those other investigations. In my world of communicable disease, we're still working on tuberculosis investigations. We're still conducting investigations for syphilis, chlamydia, and gonorrhea. We're still looking at people who have animal bites and maybe need prophylaxis for rabies. Yeah, we're out there spraying for mosquitoes to try to protect people from vector-borne infections. And our infectious disease and outbreaks team is still following up on salmonella and E. coli and hepatitis A. And so yes, those things we are continuing to do. Let's see. If a host contracted another virus such as SARS, MERS, herpes 1 or 2, Ebola, etc., does that give the host immunity from COVID-19? When I first read this, I thought, wow, this is a really unlucky person who caught SARS, MERS, herpes 1 and 2, and Ebola. But the answer to this is probably not. The SARS and MERS viruses are coronaviruses, but they're different enough from the new novel coronavirus that the treatments and the work that had been done towards vaccine on those agents is not accelerated greatly what we're looking at for what we need for COVID-19. So in general, the vaccine has begun, not totally from scratch, because they can use backbones and other constructs that are used for current vaccines to sort of plug and play the new coronavirus characteristics or their proteins or antigens and that sort of thing. But I don't expect that if you had Ebola or herpes that you're going to have protection from coronavirus. Should you wash your cloth mask every time you come back home? You should wash it once a day or immediately following getting it soiled. So if it gets wet or if you drop it or, if someone is in your face coughing, then we would want you to wash your mask. But in general, wash it at the end of every day. Don't turn it wrong side. Don't wear it one way on Monday and then turn it wrong side out for Tuesday. That's not the way it works. You need to wash it in hot water at the end of the day if you're going to wear it again tomorrow. All right, here is a question. Are you more vulnerable to infection in a retail setting or in a church setting? So, there's nothing necessarily unique about these unless you're not adhering to the 6-foot distance. If you're adhering to, no gatherings more than 10, and even with 10, 6 feet apart, and if you're adhering to that in your retail and your church setting, there's nothing that would make one or the other of those more likely to spread the virus or to transmit. So again, when you're out in a retail setting or in a church, make sure you're wearing your face covering and make sure you're at a 6-foot distance. And remember, except for retailers that have been allowed to reopen, we still are not allowing gatherings of more than 10 people who aren't in, the same household. So that hopefully answers that. Then there was a question about the fact that the school system is planning for ways to reopen the schools. And the question was, how in the world can 3,500 students be 6 feet apart? That's a good question. I'm not involved with that planning, so I'm sure that the Mobile County Public School System is working on that. There are I read or hear on the news some novel things that are going on about planning, like, maybe having lunches at your desk instead of going to the classroom or to the cafeteria, maybe eliminating recess or doing some different things like that. But I'm sure that Mobile County is working on that. Have y'all received guidelines for opening summer camps from state officials? The only guidance that we have from state officials is the Safer at Home order. Read it carefully, please. If you have questions, we're happy to help clarify for you. What that says is that childcare and daytime activities for essential workers may continue if there's no more than 12 students. So take a look at that health order and read it very carefully before you decide if you're able to have a summer camp. Address nursing home testing, please. So I'm not sure the full context of that Facebook request, but just to give you an example, anytime we have a cluster of cases in a location, so that means, for the congregate settings for long-term care facilities, it's usually a nursing home, an assisted living, or a specialty care. A congregate setting can also be a jail or detention center. It can be a group home. It can be a high-density apartment complex, right? In these areas, it's a challenge to control entry and access. And once you do have the introduction of the virus, it's difficult to stop the spread of the virus in those facilities. But what we do is anytime we see two or more, during COVID, if we have one resident or one healthcare worker in a facility that has COVID, we treat that as a cluster, as an outbreak. And we immediately start consulting with the facility to help them think through quarantine and isolation, expanding testing, movement of their workers and their workforce, particularly their healthcare workers, asking them if they need assistance with acquiring personal protective equipment. Do they have the ability to test on site? All of these things go into it. So yes, we have been recommending that all of our long-term care facilities, there are around 37 of them in Mobile County, that they all develop on-site capacity for testing for COVID so that they would be able to pull the specimens so that they could quickly test someone that they think might have COVID. And then if they do detect COVID in a resident or patient, then we start recommending that they do more widespread testing immediately. So yes, there is a lot of testing going on in nursing homes, and actually this is the early testing in our first facility that had an outbreak. That's where we learned a lot of important information with which we are now making recommendations to other facilities. Things like the fact that asymptomatic infection occurs. They had a lot of patients that were asymptomatic that tested positive, and a lot of staff that were asymptomatic that tested positive. And that made it incredibly difficult for them to get ahead of that. Okay. Here is the last one I have. Says, I have a newborn in my house and I haven't found out what my test has said. I call, but they tell me to talk to somebody else and nobody seems to know. This is a problem that we have heard. I thought that it was getting a lot better. You have to get the test result from your provider. So if you tested at one of these pop-up clinics that maybe is no longer even testing, you have to get in touch with that provider to obtain your lab result. The state lab can't give it to you. The commercial lab can't give it to you. I can't give it to you. So please contact the entity that performed your test, and just, if it's been more than a couple of days, they should have gotten the test back, and just try to work with them to get your test result. I think in most cases it's gotten better. There still sometimes are some situations where it takes a little bit longer, or perhaps the specimen has to be recollected. So that's all I have today. Have a lovely weekend. The weather is supposed to be good, but remember, strictly follow the state health order and wear your cloth face covering if you're out and about. Thanks. We'll talk to you next week.